Alright guys, so in this quick video I am going to discuss the questions that I had asked in my Telegram quiz, and the topic was lens and its diseases. And of course you can follow my Telegram channel, it is in the description of this video. You can also follow me on Instagram. Alright, now the first question was posterior subcapsular cataract is best diagnosed by. So what is posterior subcapsular cataract? So we divide cataract into multiple anatomical types based on its location. So this is the lens which is of the pink color. Wait, I am making it here. So this is the lens which is enclosed in a capsule. Now if there is opacity in the center of the lens, the center part is nucleus, you call it as nuclear cataract. If there is opacity at the periphery of the lens, so you call it as cortical cataract, because peripheral is cortex. But if there is opacity between the anterior lens capsule and the anterior surface of lens, you call it as anterior subcapsular. And posterior subcapsular is if there is opacity between the posterior part of the lens and posterior capsule, so that is posterior subcapsular. If there is opacity just at the posterior pole, which includes the capsule as well as the lens, you call it as posterior polar cataract, so that is PPC. But PSC is between the posterior surface of the lens and posterior capsule, and it is best diagnosed by distant direct ophthalmoscopy. So you take direct ophthalmoscope, you stand at a distance of approximately 25 centimeters, you throw a light and the light is going to strike the retina, and when it is reflected back from the retina, so the opacity which is present between the posterior part of the lens and the posterior capsule, it stands out. So it is done from a distance of 25 centimeters, and it is the best technique to diagnose posterior subcapsular cataract. Otherwise you usually use slit lamp examination. Yes, okay. Now coming on to the second question, second sight of old age is generally due to which cataract? Now for that you will have to understand one concept. Okay, now what happens normally is, check this out. So this is the cornea C, this is the lens L, and this is the retina R. Okay, now when the light rays are coming from infinity, right, they are focused in front of the retina. Yes, this happens in normal persons, right? But when you see towards a near object, the light rays coming from a near object are not parallel. These are coming from infinity, so the light rays are parallel. But when you focus on the near object, the light rays are divergent, and when they are divergent, of course they are not focused on the retina, but they are focused behind the retina. Yes, but now you'll say, okay sir, but then how we are able to see the near object if the light is being focused behind the retina? Because of the act of accommodation. So there is increase in the anterior curvature of lens, which is associated with meiosis and convergence, such that the point of focus is brought from behind the retina to on the retina. So basically increase in the anterior curvature of lens leads to increase in the power of the lens. What is the normal power of eye? Normal power is approximately plus 60 diopter, out of which 70% is contributed by the cornea and 30% is contributed by the lens. But when you focus on the near object, there is increase in the lenticular power, the corneal power remains the same. All right, have you understood? Okay, now if the patient has got nuclear cataract, so there is opacity in the nucleus, yes, but what happens after 40 years of age? After 40 years of age, there is physiological decrease in amount of accommodation. So that is why you must have seen that your parents, your grandparents, they are absolutely okay, but when they focus on the near object, they read magazine, they watch, you know, a message on a mobile phone, they see a magazine, and they wear near glasses. What is those near glasses? So those near glasses are convex glasses, and they are to compensate for the loss of accommodation due to a condition. What is that condition? That is presbyopia, which is physiological loss of accommodation due to age, because with age there is loss of elasticity of lens capsule, due to which the lens is not able to increase its power. Yes, and there is weakening of the ciliary muscles, because when the ciliary muscles will contract, there will be increase in the anterior curvature of lens, isn't it? Okay, now what happens is, suppose there is nuclear cataract. Yes, now what is the refractive index of the lens? So it is 1.38 to 1.40, while 1.38 is that of the periphery of the lens and 1.40 is that of the center of the lens. That means the cortex, and 1.40 is that of the nucleus. But when there is nuclear cataract, so that means there is more and more deposition of proteins in the center of the lens. So technically cataract is when there is more deposition of the insoluble proteins in the lens. Yes, so this 1.40 becomes 1.44. Now the light rays will have to pass through lighter medium, which is cortex, to even more denser medium, which is nucleus. So you know, when the light ray passes from the lighter medium to denser medium, there is bending of the light rays towards the normal. So this is your lighter medium, this is your denser medium. So light rays are passing, they are getting refracted, so it will bend towards the normal. But when the light ray pass from denser medium to lighter medium, it will bend. So this is normal, it will bend away from the normal. So this is what normally happens. Yes, okay. Now when the light rays are coming from infinity, yes, and the light rays are passing through the 1.38 cortex to now 1.44 nucleus, so they are going to bend more, such that now they are focused in front of the retina. That is why in nuclear cataract there is index myopia. Index means due to change in the refractive index. Myopia is the patient is not able to appreciate the distant objects clearly because the image is formed in front of the retina. I hope you have understood. Okay, now what is cataract of second sight? Now because of loss of accommodation with age, after 40 years of age, you know, the cataract happens to be after 65 years of age. But by that time, when the cataract happens, the patient is already using the near glasses. So these are distant glasses, the near glasses for seeing the near objects clearly, hai na? So what happens one fine day when the patient will get up? Of course, the patient will not be able to see distant objects clearly, but one fine day, I always tell you one scenario. I am not going to say it here, that is only meant for the classes, but just saying that what happens is the distant objects not seen clearly, but when the patient is able to is trying to see the near object, so what happens, the patient is able to see the near objects clearly without the use of near glasses. Why? Because of, again, there is change in the refractive index. Yes, now the image was falling behind the retina in normal persons, in normal lens, but when there is more bending of the light rays, even without the use of glasses, the image starts projecting on the surface of the retina. So that is why you call it as cataract of second sight. So it is like the patient gets up in the morning one fine day. I always tell one story. I'm going to give you a small, small excerpt of it. When the patient gets up in the morning, and usually the patient picks up his near vision glasses like this, and the patient opens the newspaper, and the patient says, "Arey, I'm not able to see anything. Why is it so?" Again patient wears, "Oh, I'm still not able to see anything. Why is it so?" So then the patient suddenly realizes, "Arey, without the glasses, the patient is able to see everything. The patient is able to read every sentence clearly without glasses." So it is something like, "माँ, मुझे कुछ नहीं दिख रहा है माँ, माँ, मैं सब कुछ देख सकता हूँ माँ." So it is like this, है ना? So this happens to be in nuclear cataract. Done? Okay. Now this is the clear-cut answer. So index myopia is another point which happens to be in nuclear cataract. But if I talk about cortical cataract, there is index hypermetropia. All right, now lens contains which antigen? So the answer is pretty straightforward. It is sequestered antigen. Sequestered antigen is that antigen which has never been exposed to the bloodstream of the body. Now what happens is, if there is any trauma leads to rupture of the lens capsule, so there is release of the lens protein in the anterior chamber. Now if this lens protein gets stuck in the pores of the trabecular meshwork, it leads to raised intraocular pressure. That intraocular pressure will damage the optic nerve head or may cause visual field changes. You will call it as phacoparticle glaucoma. Phacoparticle glaucoma. Yes. Okay. There is another concept which is phacoantigenic glaucoma or phacoanaphylactic glaucoma. What is that? Because the lens protein is a sequestered antigen. When it is released in the anterior chamber, so it will cause inflammation in the anterior chamber, and when it cause inflammation in the anterior chamber, so it causes uveitis, है ना, inflammation of the iris and pars plicata of ciliary body. So there are cells, there are keratic precipitates, so due to which it leads to raised intraocular pressure in the anterior chamber. That is known as phacoanaphylactic glaucoma or phacoantigenic glaucoma. That is a difference. So phacoparticle also, or you can call it as lens particle glaucoma. It's one and the same thing. So that is the difference between the lens particle or phacoparticle or this phacoantigenic or phacoanaphylactic glaucoma. I am pretty confident that you are already aware of another two important types of glaucoma which is associated with lens, that is phacomorphic glaucoma, which is seen in mature cataract, phacolytic glaucoma, that is seen in hypermature cataract, Morgagni's type. Okay, now which of the following is correct about this image? So what is this image? Can you appreciate the small dots? Of course, these dots are increased in size because that is taken via slit lamp. So this is your which cataract? This is your blue dot cataract. Now if you can diagnose this image that okay, spot diagnosis, blue dot cataract, then you are able to answer the questions which are asked. Is it visually significant? No, this is not visually significant. It is not associated with loss of vision. Sometimes it is actually discovered by chance. Okay, most common type of cataract in children. Yes, it is most common type of cataract is in children. But if the examiner asks which is the most common type of cataract in children which is visually significant, then there is lamellar or zonular cataract. Otherwise, overall, it is blue dot cataract. Surgery is required as early as possible. No, because it is visually insignificant. Why would you require surgery? Amblyopia therapy should be started soon. Why? Because there is no requirement of cataract surgery because this is visually insignificant. So why would you go on for amblyopia therapy? No amblyopia therapy is required because there is no loss of vision. If there is no loss of vision, so one eye is fine, another eye will also be fine, which is having blue dot cataract. So no requirement to start amblyopia therapy. Okay, all right. Which step is not done in FLACS? What is FLACS? FLACS is femtolaser assisted cataract surgery. Femtolaser uses a laser which has got a frequency of 10 raised to power minus 15. Yes, wavelength of 10 raised to power minus 15. Okay, femtolaser assisted cataract surgery. It is 10 raised to power minus 15 is your femtosecond. 10 raised to power minus 15 nanometer. Okay, all right. Now when you perform a cataract surgery, you first give a main incision. I am talking of phaco. You first give a main incision with the help of a keratome, right? And then you perform capsulorhexis. Then you break the nucleus into small pieces, and with the help of phaco probe, you aspirate the emulsified lens material, and then there is an empty capsular bag which is left. Then you implant the artificial IUL. Now out of all these steps, mote which I told you, 3 steps are performed by femtolaser. Rest everything is done via phaco only. Phaco only means the aspiration part, that is a phaco probe which aspirates the emulsified nucleus. So what are those 3 steps which are done in FLACS? So one is you give a main incision. So you give a main incision which is corneal incision. So the incision is pretty sharp and the edges are pretty smooth. right? So of course if you are using a laser, it will be very well demarcated. Otherwise, if you do it from your hand, you may lead to button holding, you may lead to irregular incision, you may lead to ragged margins. So this prevents those few complications. Okay, now second is you perform capsulorhexis. Capsulorhexis is you make a small window on the anterior lens capsule from which you are going to emulsify the lens and take it out, and you are going to implant the artificial IOL. So capsulorhexis is also done with femto laser, so it gives very fine circular capsulorhexis. Yes. And third is your lens fragmentation, which I told you that you break the lens nucleus into multiple pieces. So lens fragmentation is also done with the help of femto femtosecond laser. Okay, but if I talk about scleral tunnel formation, scleral tunnel formation is actually done in small incision cataract surgery, manual small incision cataract surgery. You go into partial thickness of the sclera, then you enter into corneal stroma, from which you enter into the anterior chamber. So these three steps are actually done in your flax. And once the lens fragmentation has been done, then you shift the patient from one table to another table, or you can install the phaco machine on the same table. I remember when I was in PGI, so we used to shift the patient from one table to another table, and the patient will stand up and will lie down on the other table, and then you will start doing your phaco emulsification like usual, like you do, hai na? Phaco, you put in the phaco probe and then you emulsify the already broken pieces, and then you inject viscoelastic and you inflate the eyeball and inflate the capsular bag. Then you implant the artificial IOL, whose power is already calculated with the help of biometry. Biometry consists of A scan and keratometry. Yes, and you know the most common material of the foldable IOLs which you use is acrylic. So every single line that I just spoke is your PYQ or PYT. All right, so guys, coming over to the last question. So this is identify the cause. What is this? So are you able to appreciate the lines on the lens? Are you able to appreciate? So this is your spoke wheel cataract, hai na? So when I say this is your spoke wheel cataract, so you know which condition is associated with this. It is clear cut, which is Fabry's disease. But you should know myotonic dystrophy leads to Christmas tree cataract. Yes. And atropic conjunctivitis lead to shield cataract, and Wilson's disease lead to sunflower cataract. So these are another 4 important MCQs. And diabetes overall leads to early senile cataract. Type 1 diabetes lead to snowflake cataract. Type 2 leads to early senile cataract. But since type 2 is more common than type 1, so overall, so it is early senile cataract. All right, and galactosemia leads to oil drop cataract. Okay, so these were the few Telegram quiz questions that I wanted to discuss. Of course, I did not go into much of the details because I wanted to make it pretty crisp, and I believe if you are giving the quiz and you are giving it after going through the notes, it is my kind request to all of you, please go through the notes. What I do is I announce the topic quite early so that you are well prepared while giving the quiz. I don't want you to just randomly open the quiz, solve it, and then come here and watch the video and think that okay, this topic is prepared. This is not for your preparation, this is for your revision. So here I'll be more focused on giving you PYQs, PYTs, and a little bit of concept. If you have not understood anything so far, still you can go back to your videos or go back to your notes. But if you don't want to do that, it's absolutely okay. You can send me a WhatsApp with your doubt and I'll try to respond to you as early as possible. 9814111330 is my WhatsApp number and you can get back to me. All right, chalo, with this I shall take your leave. Best wishes from your ophthalmology educator, Dr. Manish Chhabra. Bye bye.